It started with a glance. A nurse, midway through her shift in a busy emergency department, noticed something odd. A red sharps container mounted beside a patient's bed was filled beyond the line. A few capped needles poked upward, teetering on the rim. It wasn't overflowing, not yet, but it was close. She meant to flag it. She meant to change it after finishing rounds. But another patient coded. A family needed updates. A physician called her into a trauma bay. The moment passed. An hour later, a junior staff member brushed against that same container while adjusting the bed rail. One needle, barely capped, tipped and pricked her forearm. It was a clean stick, but blood was present. And with it, the anxiety, the test protocols, and the haunting question, could this have been avoided? In healthcare, safety observations are both more nuanced and more critical than in almost any other field. Because here, the margin between noticing and reacting doesn't just protect the worker, it protects the patient. And yet the pace, pressure, and emotional toll of care environments often blur the line between what's urgent and what's important. Hospitals, clinics, long-term care facilities, they're layered with risk. Wet floors from hurried cleanups, unsecured oxygen tanks at the bedside, medication carts left momentarily unattended, IV poles too close to door swings, glove boxes empty when needed. These are not hypothetical risks. They are real, repeated, and routinely missed. One of the greatest challenges in healthcare is normalization. When you walk into a room and the bed alarm is disconnected, do you plug it in or assume it was turned off for a reason? When a patient ambulation belt is worn but still functional, do you tag it or use it just this once? When an overhead lift motor hesitates but resets after a second, do you write it up or move on? These are the micro decisions that build the foundation of safety culture. And in healthcare, they're compounded by compassion. Many caregivers hesitate to delay patient care for an equipment issue, to pause a task for a procedural check, or to interrupt a doctor with a safety concern. But here's the truth. Patient safety is worker safety, and vice versa. The two are inseparable. Let's step into a real incident that occurred in the U.S. Midwest. In a pediatric ICU, a nurse noticed that a supply cart had been temporarily relocated near the fire exit during renovations. She mentioned it to a supervisor in passing. The supervisor was swamped. The cart stayed. 2 days later, during an electrical short, smoke filled the hall. Staff tried to evacuate. The blocked exit delayed the response by seconds. Precious seconds. No one died, but 2 patients required additional respiratory support after smoke exposure. The review? Clear. The observation had been made. It just wasn't acted upon. Observing isn't enough. We must follow through. Healthcare facilities that excel in safety foster 2 critical ingredients: awareness and voice. Awareness is trained. Through regular walkabouts, peer coaching, and safety rounds, staff can develop the eyes to spot early signals. A slightly tilted IV pole may mean a bent wheel. A slight rattle in a wheelchair may mean a loose axle. A delay in sink drainage may signal a backup that could overflow during code blue cleanup. These aren't trivial details, they're signs. Voice, on the other hand, is cultural. It must be safe to speak, safe to pause, safe to question. In healthcare, hierarchies are steep. It can feel intimidating to raise an observation to a senior physician or experienced charge nurse. But the best facilities break that barrier down. They use interdisciplinary huddles, open-door policies, and non-punitive reporting to ensure every voice counts. In Japan, a hospital introduced a simple program called One Glance, One Guard. Every shift, every worker, nurse, porter, admin, cleaner, was asked to note one safety concern during their shift. Not a checklist, just one thing. At the end of the day, it was discussed openly. Some were small, a missing glove box label. Some were serious, a recurring drip from an oxygen humidifier. Over time, incident rates dropped, not because the environment changed, but because the eyes in that environment became sharper. There's a deeper layer here too, the emotional labor. In healthcare, people care deeply. They give, they stretch, they absorb trauma, and sometimes that emotional load blunts observation. Fatigue sets in, compassion fatigue, moral injury, cumulative stress. These aren't just mental health topics, they're safety topics. Because a burned-out nurse is less likely to notice that the medication pump tubing isn't seated properly. A tech rushing from code to code may not spot the missing bed break. Supportive environments don't just tell staff to observe, they support them in being well enough to observe. And what about infection control? Healthcare observations extend beyond trip hazards and mechanical risks. They include watching for proper donning and doffing of PPE, ensuring hand hygiene stations are stocked, spotting cross-contamination risks between rooms. During the COVID-19 pandemic, Hospitals worldwide saw how quickly safety could be compromised when observation protocols failed, even briefly. One case from the UK during the first wave involved a hospital ward where staff were reusing face shields intended for single use. An orderly noticed the biohazard bin was consistently overfilled and that shields were being stacked on top. She flagged it. It turned out a supply chain delay had limited access, and staff were reusing without full decontamination. The fix was rapid, but it took that one observation to stop a potential outbreak. Healthcare safety observations aren't glamorous, they're quiet. They happen between codes beneath urgency around grief, but they matter deeply. So, here's your challenge. Whether you're a caregiver, a cleaner, a clinician, or a cook, take one moment today to pause and see. Not just the patient, not just the chart, but the environment. Ask yourself, what's here that shouldn't be? What's not here that should? What am I walking past today that I'd call out if someone got hurt tomorrow? Because in healthcare, what you notice can change everything. In our next episode, we head to the warehouse, a space where speed, space, and stacks collide, and where observation can mean the difference between flow and failure. See you there.